This is Mazakine and this is Gage. He's a retired service dog. She's a service dog in training. Today we will be going over deep pressure therapy and light pressure therapy. Deep pressure therapy is a little bit easier for her to learn, so I'll go over that first. That tends to, if your dog is like a super cuddly dog, that's typically going to be easier for them because they just want to jump on you anyways. So you can do it from a sitting or laying down position. You can teach it both ways. It's however you want it. So for pressure, which is deep pressure therapy, come on Meskin, come on. I'm just going to lure her, good girl, good pressure. I'm going to lure her over here, and I want about half of her body across my legs. That way it's really deep pressure therapy. Light pressure therapy could be like the front legs on you and the head, or just the head, or just a paw. That's what light pressure therapy would be. For deep pressure therapy, you want about half the body on you, so that it's really putting pressure on you. Come on, deep, good girl. And if you're someone who's using both, you want to make sure that you have a word for each one. So she knows pressure, because I don't really use light pressure therapy with her. But if I did, I would say deep and light. She doesn't do LPT. I don't really have a need for LPT. Good girl. So she only knows DPT, which is why her only command is going to be pressure. But make sure if you are using both, you have a different command for either one, so the dog can really. Come here. Sit. Pressure. Oh. Lay down. 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 Good girl. Down. All the way. Good girl. So she's showing you this way. Usually she doesn't do this, but she's very excited about getting a treat today. So usually I have her lay this way. I'm okay as long as she's putting at least half her body weight on me. So all I did there is I'm taking it and I'm luring and I'm saying pressure. Good girl. Good pressure. And I'm wanting, this is about half, and she has all of that on top of me. Don't you do that. So right there you saw me correct her, because I saw her starting to curl her lips at my other dog, which means she's starting to get possessive over the treats. So I corrected that before anything bad happened. Good girl. We're still working on that with her. It's pretty common in shepherds. They're just possessive dogs. They're very dominant. So right here I'm asking her to lay down, and then I'm giving her a stare. Basically I'm asking for submission because she was starting to get too aggressive and too excited. So for deep pressure therapy, you want to make sure about half the body weight is on top of you. They have their legs over you, and you want the head down because that's standard. If you don't want the head down, that's fine, but for standard you want the head down. So you want to teach them a command that says head down, and for head down you can do that teaching them even from here. Head down. Head down. Good girl. So right there she's putting her head down, and that's really all it is. You just ask them to put their head down, and you can lure them down. Head down. Good girl. So we just had to take a little bit of break. She was starting to get too worked up, and I had to make her calm down for a second. Reactivity, last video. Fun stuff. She has an issue where if Gage is around and she's getting treats, she will try to snap at him. So I watched for her setting on him, and then I immediately corrected. So if you heard me saying throughout this video, that's because he's right there, and I saw her start to get set on him, and that usually means she's going to snap at him. She doesn't attack him, but she does a little nip, and I don't allow that behavior in my house, whether it would be a pet or a service dog. That's unacceptable behavior for me, and it should be unacceptable behavior for anyone who has a dog. That's just not okay. They're not allowed to do that. So now she's pouting because she got in trouble. That's what she does. She's a baby. So anyways, for deep pressure therapy, you want to make sure about half the body weight is on top of you. Their head is down, and at first you want to work them where it's just a split second of the deep pressure therapy. You don't need them to hold it for 30 minutes right away. That's a big mistake that people make, is they want to push their dog to hold it for longer right away. And when the dog is first learning that, you can't push them to hold anything. Like, that includes stays, that includes holding an object in their mouth, that includes holding a down stay, it includes anything. It's just a split second. That's all you need when you're first teaching something, and then you want to praise that, and then you can build that up slowly. You're not going to get 30 minutes right away unless you have a unicorn dog that picks up on everything and was able to just sit there and do it for 30 minutes straight, and that's unlikely to happen, especially if you have a puppy. They're not going to want to lay there for 30 minutes with you because they have so much energy, they just want to run around and they just want to get around. So be patient with this. Don't expect an hour hold right off the bat. Don't expect a 30-minute hold. Expect a 10-second hold at the most within your first couple tries. You just want to lure them across you or up you, depending on what you want. If you want them to come up, that's fine. If you want to come across, that's fine. That's up to you. Again, this is one of those things that it's a test that you're wanting them to do, so it needs to be in a way that actually helps you. And whatever you're using DPT for, it's actually helping that. So if coming across isn't as good for you, or doesn't help you as much, coming up may be a better option. It just depends on you. So now we'll go over light pressure therapy, or LPT. What she's doing now is what she was just doing was actually light pressure therapy. Light pressure therapy is just the head or like the front of the leg, so like this part of the leg. If the elbow's on you, that's when it starts getting into DPT, but up here, if that part's on you, that's fine. It can be just the head, it can be just a paw, it can be both. That's still LPT. Or if you have a really small dog that's probably like 15 pounds and under, that's going to be LPT even if they put their whole body weight on you. This isn't a test that I use. I use DPT. Light pressure therapy just isn't something that's helpful for me in any way, but I can show you how to do it. So head down. So you need your dog to know head down if you're wanting to use the head. If you're wanting their head to be on you, that's usually something that you would use like when you're sitting in a chair that's higher up, or you're sitting like this where putting their paws on you would be kind of uncomfortable for them. So what she's doing right now, good girl, is LPT, and she's using just her head right now. If I were to spread my legs out, I could get her to put her feet over. Come here. Good girl. Good girl. So there's her paw right there. If you need to adjust them, you can. That's fine. You can pick their feet up and just kind of place them for them so that they understand what you're asking. If you need to hold them back so they don't go forward, you can do that. You can just put your arm out. Don't push them back. Don't shove them down. Just hold here. If you need to put a little bit of pressure on their butt to get them to lay down, I'm not saying shove your dog to the ground. I'm literally just saying like this. That's fine too. Some dogs will just put their butt in the air and put their kind of kneel on you with their front legs and keep their butt in the air, so you just have to kind of put a little bit of pressure to tell them, okay, you need to put your butt down, because that's not how this works. That's really all there is to light pressure therapy and deep pressure therapy. It's just luring your dog, and you can readjust them physically as needed. They're not going to get it perfect on the first spot. You know, some dogs are going to go straight for your neck when you lay down on the ground, so you're still going to have to reposition them and lure them to the spot that you want them in. You have to let them get comfortable, because if they're uncomfortable, they're not going to be able to hold it, and you want to make sure that they are in a comfortable position, because some people are going to need DPT or LPT for 30 plus minutes. So you want to make sure that the dog is able to do that. And saying that, the dog has to be comfortable. The dog's going to move and get up and readjust. That's fine. Let them do it. I think that's everything. If I missed anything, let me know in the comments below. I feel like I did. These were so short. I think I'm just used to like 20-minute long videos of like 8 different topics. But I think I got everything. I hope I did. If not, as always, let me know in the comments. If these techniques don't work for you, let me know in the comments. If you're subscribed and you would like to get notifications as videos come up on YouTube, you can hit the bell notification right next to that subscribe button. That way you'll get notified every single time I post. I post Mondays, Thursdays, and Saturdays. This Saturday will be a later post because I ended up having to take a shift for someone, so editing the video is going to be pretty hard because I'll have no time that day to edit it. So it's going to be posted later on, but I'll make sure to tag you guys as it comes, once it comes up. This video is a mess because I was up all night with her because she wasn't feeling well last night. So now she's got abundance of energy because she ate something she shouldn't have, so that's why she's being so snappy today, and why I had to kind of push her down. Well, I didn't push her down, but kind of like tell her to lay down and calm down. And the reason she's calm right now is because I gave her the look, which basically I just stare her down until she lays down, because she knows that I'm not playing anymore. That's not okay. That's not acceptable. And sometimes you just have to do that. If she's about to snap at him, I can't put up with that, and that's unacceptable behavior. We've been working on that since I got her. There's a lot of improvement there. She's quit doing it with toys, but with treats, she still can get a little snappy. So we're working on that, but not every dog's perfect. What are you gonna do? As always, questions, comments, concerns in the comment section, or message me personally. Either way works for me. And we love you.